Well, hello. This is Deirdre Gilbert, and I'm with the National Medical Malpractice Advocacy Association. I am coming to you live today. Today, I am going to be talking about the corruption in the Joint Commission. I've been getting a lot of correspondence lately as it relates to those of us who have been victims or who have had to deal with the Joint Commission, who has been having to talk and to find the truth about their loved ones and the death of their loved ones or the harm that their loved ones have had. So I'm going to come to you today and we're going to talk about the Joint Commission. And when I finish, I will send the links to you all so that you can have this information, so that you can go and you can research this yourself and you can look at this on your own time. Now, the reason I'm coming to you is because some years ago, my daughter was the victim of medical malpractice. And she died in a hospital system, and I'm not going to be afraid to say the hospital, Memorial Hermann Hospital in Houston, Texas. After my daughter's death, I filed a complaint and requested the Joint Commission and the State Health Department to go in and do what we call an investigation of her death. She had died within 24 hours, and they took her and was supposedly had done an autopsy, medical examiner, and was told that they did not do one. But we got an autopsy done. So after receiving the autopsy and finding the truth of what actually happened to my daughter, it was clear that there was negligence. It was clear that it wasn't a natural death. It was clear that they had covered up her death and didn't tell us. So we were trying to find out what could we do to get these answers. So in this journey, I believe pretty much everybody who is in this journey right now can probably say that the hospital systems and all of the state agencies that were told as the entities that will protect them did not. So they didn't protect us. They didn't do what they were supposed to do. So we filed this complaint. And the first complaint was with the State Health Department. And the State Health Department went in, did an investigation, and sent me a letter, which seems to me like a form letter like everybody else. And this letter simply says that they did not find any discrepancies or anything that went wrong within the hospital system. And you know that's not right. So we sent a complaint to the Joint Commission. And unknownness to me, like everybody else, you don't really know what these people do. So you file your complaint. You file your complaint, and they come back and say the same exact thing, that the hospital is not guilty of anything wrong. So what do? You know that this information is not correct. You've tried to contact the medical board, and the medical board will send you the same information, that they did not find any issues with doctors or anything, even with your evidence. So let's talk about this. I stumbled up on an article this past week is because I had been talking to a Dr. Van Boven, and Dr. Van Boven looked at my daughter's records, and this is 5 years later, which has been 5 years now, and had never met me before up until the conference that we had a month ago. So it was very strange because once he read my daughter's book, Mama, Help Me Please, he realized that the hospital had covered this up. And he began to ask me questions about the protocol, and did I know about the state protocol? And sure enough, I knew about this, and I had written exactly what he had asked me to do. So he wanted me to ask these questions about what is the protocol when someone dies in a hospital with the Joint Commission? And coming to find out, there are statutes, there are guidelines that the Joint Commission has. So let's find out, what is the Joint Commission, first of all, because many people probably do not know what the Joint Commission is. But the Joint Commission is an accreditation that actually gives accreditations to hospitals. And what's disturbing to me is that all of these entities that people have to complain to are what they consider voluntary, which simply means that they volunteer that they harmed you. So if the family members don't make a complaint, or if a doctor don't make a complaint, or if anybody don't make a complaint, then the death and the harm that you face, nobody knows about it. So the Joint Commission is supposed to go in and evaluate your complaints. And simply, this is not happening across America. And I want you to know what to do. And the only way that we as a community can change these things is that we will have to bring these things to light. Many people claim, they want to say, you're nothing but what do they call it? Conspiracy theorist. And I'm like, you can call it what you want, but I am finding out the truth. The truth of the matter is that before we had the internet, all of this information was hidden under the cover. Now that we have the internet, many people across the country is saying and doing the same things that I'm going through or that you are going through as a community. So, the Joint Commission. The Joint Commission is supposed to go in and actually find out what happened in what they call a sentinel event. A sentinel event actually is nothing more than harm or danger that has caused death or a loss of limb or a loss of livelihood, permanent damage, leaving sponges in the stomach. And when those types of things happen, the hospital by law has an obligation to report this. But there is no law out there that will require them to report it. Simply, it is stated on the Joint Commission's website that it's a voluntary job or whatever. They don't have to tell you anything. They can just volunteer that information. My question to you is, who do you know will volunteer this information about deaths? Because again, you have to understand the Joint Commission is an accreditation. They are responsible for handling the Medicare and Medicaid of these hospitals. You know that the Medicare and Medicaid is the big money maker of these hospitals. And without it, they won't survive. So let's say a Joint Commission comes in and says, you know what, you all did not tell us that these patients died. And if they know that this hospital has 5,000 complaints, guess what? They lose their accreditation and they will lose everything. Nobody's saying anything. So they're not reporting the deaths. They're not required to report the deaths. So with this, what do we do as a community if they're not having to report it? When you report it, they tell you that there is nothing on site or anything that they looked at that will say that the hospital was in the wrong. Now, I looked at a lot of things and, I'm stumbling up on things and I'm amazed and I'm excited because I can share this information with you. Because again, this information is not going to come to you because you want it. We're finding this information, use this information. We will have to start talking to our legislators and forcing these people to create laws that will protect us. So, on last week, as I was looking at this information and trying to find out what is the Joint Commission, again, I stumbled up on the internet with the Dr. Goldberg. Dr. Goldberg actually wrote a lot of information about the Joint Commission, and it was after the death of his son, where his son was in Thailand and for 10 days was sick. And he received a phone call on the 11th day, if I'm not mistaken, where his son was supposedly have died. He said that he had talked to his son numerous times during this week, the 10 days, and son was fine. He gets a phone call that his son is dead, and he was like, no, that's not true. He gets to Thailand, and this is where he finds out the true meaning of the Joint Commission, the true meaning of how hospitals lie, falsify records, hide the evidence, and actually get away with murdering people within a hospital setting. So, again, in 1965, well, let's just put it like this. Since 1965, the Joint Commission is actually what we call an oversized conglomeration. And it's the end and all end for hospital systems. So it's the end for them and the beginning. So whatever they say, it is. Another amazing thing about this particular entity is that they are run by doctors. So you have a entity that is supposed to be protecting the public, but is run by physicians. How are you to get anything done if it's run by a physician, right? And they come back and tell you, well, no doctor is saying anything wrong. They're not doing anything. They're doing the right thing. So let's talk about this. The Joint Commission is a 501c3. It had never been heard of, according to Dr. Goldberg, until 2006. They've obtained this 501c3, stating that there's some kind of charity, religious, or educational organization, because that is what a 501c3 is for. A history of JC is below, and this is what we're going to talk about. And it goes back to 1910. So this stuff is way back, deep embedded in issues before we even knew what happened. So the JC accredits healthcare facilities in order for them, again, as I said, to receive Medicare and Medicaid benefits. This piece of, or these benefits are very vital to the viability and the stability of these hospitals. Without it, they cannot function. So let's talk about this again. When in 1965, Congress had empowered under the Medicare Act to deem hospitals worthy of receiving Medicare funds. Revenue, which now accounts for about 50% of more of the income that's received from hospitals. The JC has been given significant power to revoke accreditation, sanction healthcare organizations, and even suspend their accreditation, which, as we would both know, that would be virtual death if they came back with information that this hospital did something wrong. So clearly, they're not going to do what they say they're going to do. It is stated that less than 1/10 of 1% of the complaints or anything or any of these hospitals, which is now more than over 20,000, have ever received a revocation. Again, that's less than 1/10 of 1%. So that simply means they're not filing the complaints. They don't care. They don't care that your loved one has been harmed. They have the power of the law behind them. They are linked up with the Department of Health and Human Services. This is something that I did not know. But what get me is that the Joint Commission is given the right to charge for services with a fee structure. And that fee structure is now the Department of Health and Human Services. That's another entity that you have to complain to when you file a complaint in your states. That's the first place. So now you got the state health department, then you got the Joint Commission. They're hooked up like this. So if they're hooked up, that simply means that all of our complaints are just not being heard and nobody is doing anything about it. So the hospital's accreditation is said to be worth trillions of dollars. So who do you know? Who do you know, Brenda? Who do you know, Gidda and Gail? Who do you know is going to say that they're going to lose their accreditation? It's not going to happen. So I'm like you. Let's try to figure out what we can do. So fraud and greed is the basics, pretty much, of this entity. You file a complaint. That complaint goes through the process. And in my case, I believe it maybe have been a month later when I received a form letter. And looking at some of the letters that I have here, and I'm going to put this in front of you because this is a letter, and this is some stuff that I got off the Facebook today. And all of these letters are coming from the Joint Commission, and they look exactly alike. I don't know if you can see this, but they look just alike, where they're not saying anything except for they're not finding any type of issues in that. You know, you can request the number of complaints, and you can request standards, and you can maybe even request a survey. But I requested this, and they ignored me. They did not even answer me. So I was like, this is not good. So you look at an agency that is corrupt, an agency that has been allowed to cover up. Now, this is how I see that it's connected. In order for all of this to work, you got to have some pieces to the puzzle. So you have the state health department, you have the Joint Commission, and then you have to have some sort of representative within your state that is writing laws that give them that type of power in order to create havoc on doctors. Actually, I was reading this same particular blog today, and this particular doctor, and it's amazing. This was a doctor who is actually speaking out against the Joint Commission, and this is what she says. Doctors are told to not report harm. They are being blacklisted and retaliated against and forced to keep their mouths shut if they want to continue to practice medicine. She states when they finished medical school, they pledged an oath called the Hippocratic Oath to do no harm. But in reality, they have been told we must report no harm. She says the days of her owning homes and yachts and planes, or just, being able to go shop limitlessly, is over. She's even thinking about leaving and going to another country with her children because she does not believe that she should teach her children in order to be successful is to be dishonest. She states that when the government created the Healthcare Quality Improvement Act of 1986, this law purported to improve the quality of health care for patients. The only thing it really did was poise hospitals and their lawyers to be in a better position to cover up their mistakes. This law gave absolute and unregulated power to hospitals and anyone on their payroll. It gave hospitals weapons to use against physicians to effectively silence them if they could not control them. The laws and policies are set to allow hospitals to effectively label non-conforming physicians in such a way that it will prevent them from practicing anywhere in the country again. Besides the government, guess who else gave hospitals to destroy competent and morally conscientious physicians? The Joint Commission. She says that all doctors know this, so they've learned to keep their mouths shut because they don't want to lose their jobs. She talked about a couple of hospitals because she was working at the time in the Baylor Medical Center at Frisco. She wrote herself, she says, to the Joint Commission that this hospital was guilty of egregious behaviors and that the CEO and the vice president of this hospital were guilty of behaviors that were earning them millions and millions of dollars. And I'm going to plug in there because I too found out that Memorial Hermann was receiving money, billions and billions and billions of dollars. Fraudulent tax returns, fake EIN numbers, sending money to companies that did not exist. This is public knowledge on their tax returns. And the CEO at that particular time, Dan Walterman, who has now retired, was making almost $1 billion a year. Again, I know you're probably shaking your head saying, no, not $1 billion. $1 billion a year. And the way he was doing it was by shell corporations that he had created within the hospital, and they were funneling money through these hospital systems to these shell corporations that do not exist. This information was given to the Internal Revenue Service. This information was given to the FBI. This information was given to the SEC, the Security and Exchange Commission. They did absolutely nothing but allow this man to retire and what? Probably with all the millions of dollars, for him to go sit somewhere and continue to funnel this money through these organizations. It is so much more beneath the covers that you all are not seeing. It's not just that, but they are working a well-oiled machine of corruption. They're stealing Medicaid and Medicare, and they're blaming it on the ones who need it for their greed and their fraud. Now, this is not something that I'm making up. This is information. This is real information. So I'm asking you again, so you have hospitals, you have to have a state representative. So you got a state representative, and in this case, it was State Representative John Zerwas, who actually they had placed over the Health and Human Services. Now, he was also sitting on the board of Memorial Hermann. He was partial overseer of the Health and Human Services, and he was also appointed by the Governor Rick Perry at that time over the Appropriations Committee. He was receiving a salary from the hospital. He also owned a business or the anesthesiologist company within that hospital. That is conflicts of interest. That's money being stolen, and it's right in plain sight, and nobody's looking at that. So we're talking about an agency that is not going to help us, that is not going to take away the accreditation of these hospitals. They're not going to tell the truth. So I'm looking for somebody that's probably out there listening to see how can we request that their 501c3s are taken away, because these entities are only given less than 1% of the money that they receive to charity. Many of these hospitals are not even accepting patients with Medicare or Medicaid. So if they're not accepting it, why are they receiving funding for it? We, again, Brenda, like you said, our lives are in the hands of criminals, and we don't have a clue. My daughter walked into a hospital, was killed in plain sight. Dr. Goldberg's son, thousands and thousands of miles away, had his son's life snuffed away from him the same way. And we're talking about thousands of miles in between. We're talking about patients and people across this country from the A to the Z. And all we are getting is absolutely no protection from these agencies that are supposed to protect us. We have our medical boards that are not protecting us. We have our joint commissions that are not protecting us. We have our state health departments that are not protecting us. Guess why? They are all run by physicians. Physicians. How are we supposed to get the help that we need if those that are supposed to be doing the right thing are not going to do it? They're not forced to do it, because that's the reason why every time we ask an attorney or these state agencies, they tell us there's nothing we can do. And the reason why is that is because our government gave them the license to do what they're doing. What do we do to bring this medical cartel, Michelle, down? It's big money, but it's not like we can't bring them down. I don't know anything that has never failed. You know the root. The root is already there. We have to pluck it, because when you leave this earth, you're going to leave your children, your grandchildren, and everybody else on this earth that will not be able to protect themselves. They are going and they're killing, and when they kill, they don't care about your age. They don't care about your nationality. They don't care if you're rich. They don't care if you're poor. They don't care if you're doctors. They don't care if you're nurses. They don't care. The bottom line is, we want to make money. We want to build mansions of hospitals. We're going to make you all pay for it, and we're going to blame you for the system. Wake up, America, because that's where we are in the medical community. It's not just organ retrievals. It's not just medication error. We know where the root is. The root is that we need to be standing on the streets for this. We need to be demanding change, that these agencies are not run by physicians who are not going to help us and who are going to protect the establishment and allow them to make millions and millions and billions of dollars on the backs of our loved ones' life. In January, I'll be in New York. not New York, in Washington, D.C. I will be in Washington, D.C. We have a lot of more people who will be in Washington, D.C. I'm not marching against the president. I don't care right at this point. I am going to be marching for medical malpractice. And if you're going to be available, you should be there too, marching with us and saying we need some change in our medical community. We need some change. I don't know about you, but we do. And again, what I'm going to do is I'm going to send you this information about the Joint Commission. I'm going to send you some links to where you can go. I want you to read this because it's too much information just for a few minutes. But I want you to be prepared to know. As soon as I get off, Michelle, I'm going to send it to you. I'm going to just send you the links because I want you all to read this stuff. And another thing I want you also to do is I've also found out that your Joint Commission, when they do go in and do a root cause analysis, they destroy the evidence. They say they simply destroy it. That's not what I said, but they say they destroy it. Why would they destroy evidence that they have gone in and done on a hospital? Cover-ups. They don't want you to know the truth. Yes, I'm angry too. We are going to fight this because if you're living it, you understand what I'm saying. If you're not living it, as my mother would say, keep on living. You will feel the brunt of this. We are now in a nation that has destroyed us by their greed. They have harmed us. They have taken away your livelihood. It's time, people, to wake up. And like my mom says again, wake up and smell the coffee because it's brewing. And if we don't speak up, and if we don't start digging, if we don't start asking questions, if we don't start demanding, we're not going to get anything changed. They're patting us on the back and taking the money. Let's get together. Another good thing before I get off here is that we do have a mobile malpractice app. If you have been the victim of medical malpractice, we have a mobile malpractice app. It's called mobilemalpractice.com. You don't have to download anything. You just go to mobilemalpractice.com. Report your story. It goes to a secure line. And what we will do is send this information to your legislators. We will send this information to your attorney general, whoever we need to send it to. And if you don't have an attorney, we will try to assist you with getting one. Now understand, find out what your statute of limitation is, because if your statute of limitation is only 2 years and you're over 2 years, we can't probably get an attorney. But what we can do is to bombard your state representatives and your congressmen with this information and letting them know this is what is happening. This is what has happened. We need you to stand in the gap. Or when it's time for you to run again, we are going to get you out of office. That's what we need to start doing. We need some new people in office who's going to help us get the right thing done. So again, I'm going to send this information to you. Look forward to it. Look for it. Keep your head up. It's not over. I'm Deirdre Gilbert. If you want to see more about what we do, go to www.nmmaa.org. Thank you for listening. Share this information. God bless you. And God bless America.